As Greg said, I'm Dr. Andrea Brunel from the Connecticut State Department of Education. One of my roles is as the 619 coordinator that oversees preschool special education for the state. I'm so pleased to see so many of you here to learn together about making sound placement decisions for children ages 3 to 5. Those of you that have been in meetings with me have probably heard me mention the Early Childhood Technical Assistance Center, ECTA. ECTA is a national technical assistance center focused on building state and local system capacity to improve outcomes for children with disabilities and their families. The ECTA Center is funded by a cooperative agreement with the Federal Department of Education's Office of Special Education Programs, OSEP. I encourage you to explore all of the fabulous resources that ECTA has to offer, and I will put a link in the chat to show you how to find the ECTA website. Please join me in welcoming our presenter for this session, Debbie Kate. Debbie is a technical assistance specialist with the Frank Porter Graham Child Development Institute at the University of North Carolina with the Early Childhood Technical Assistance Center and the IDEA Data Center. Supporting states for the past 12 years in the provision of early childhood special education services in accordance with the IDEA. Debbie began her teaching career in 1975, the same year as IDEA was enacted, and has experience as a classroom teacher, child assessment specialist, in private practice, and serving the Tennessee Department of Education as the 619 coordinator. Debbie, thank you so much for being here with us today.
Hi, Andrea. It's absolutely my pleasure to be with you today. And I should have put in my intro, I was born in the Waterbury Hospital, so I'm a Connecticut girl through and through. We're going to talk today and have a lot of information to cover, so we're going to go at a really quick pace. However, if we go too fast, please put something in the chat. All your questions that go in the Q&A box may not have a chance to have an opportunity to be answered on today's call, but Andrea and I will put our heads together and make sure that answers to your questions are provided after the call if we don't answer all your questions during the call. All right. We hope that we have conversations. We hope that you'll chat with us. We hope that you'll respond in the chat box. If you have something that you would like to share with others, please make sure to put that in the chat box so that Andrea can let us all know what you're thinking. And with that, we're going to go very quickly through the presentation. We may also have times where we get slowed down in a certain place because it's a place you're interested in, and that's perfectly okay. We'll adjust the presentation afterwards. At the end of today's call, there's an opportunity for you to let us know if there are other topics that you might be interested in having further conversations about. So with that, let's see what we're going to talk about today. We're going to talk a little bit about the legal highlights and what IDEA says about valuing inclusion. We know it's a very important principle in the IDEA itself. We know that there are, though, some nuances about preschool that make it a little more challenging than providing LRE and inclusion for school-age children. We're going to talk about inclusion facts and guiding principles for serving young children and their families. We'll quickly review the IEP process, but we'll do that with an early childhood lens. We'll talk about some guiding questions that can help you make sound placement decisions for these young kids. And then we'll talk about any additional topics that may come up. So let's dive right into the legal highlights.
Debbie, I'm sorry to interrupt you. Should we be seeing your screen share at this point?
Oh, yes, you should. I'm very sorry. It's not coming through.
It is not yet. Maybe you should try restarting it.
It says I'm disabled now.
I'm sorry.
That's okay.
Fix that right up for you.
Tell me when.
Okay, go ahead and try now.
All right. I apologize, folks, and here we go. All you've missed is the agenda that I told you about right here. And now we're going to move on into the presentation. You have a handout that covers all the things that we're going to be talking about today, even though you may not have copies of the slides just yet. So, valuing inclusion. Andrea has made available to all of you the Dear Colleague letter from the Office of Special Ed Programs that talks about what early childhood inclusion and LRE are. And one of the things that's stated in that Dear Colleague letter is that all young children with disabilities should have access to inclusive, high-quality early childhood programs where they're provided with individualized and appropriate supports to enable them to meet high expectations. And what we know about young children with disabilities and their families is what they want first and foremost is to be included and to have friends. And that goes and follows them throughout their lives. In valuing inclusion, the IDEA says that they presume the first placement option considered for a preschool child with a disability is the regular public preschool program the child would attend if the child did not have a disability. Now that's really interesting because we know that not every preschool child does have a regular public preschool program. However, that language implies that we need to have programs to serve our young children with and without disabilities, and that they should be together whenever possible. This is a review of what everyone knows about IDEA. Each public agency must ensure that to the maximum extent appropriate, children with disabilities, including children in public or private institution or other care facilities, are educated with children who are non-disabled, and that special classes, separate schooling, and removal of children with disabilities from the regular environment only occurs when the nature of the child, the severity of the disability is such that the education in regular classes, with the consideration and use of supplementary aids and services, cannot be achieved satisfactorily. We call that the justification statement. So we all know the rules and regulations, but we also know they're a little bit harder to apply to preschool at times, right? Because we don't have seats for a lot of preschool children. We're not required to provide preschool education for typically developing children or children who don't have disabilities. And yet we're being asked to provide FAPE and the LRE, or free appropriate public education, for our youngest children with disabilities. And how do we do that? We also know that a consideration that we have to put on an IEP is an explanation of the extent, if any, to which a child will not participate with non-disabled children in the regular classroom and in the activities that are described. And we all know that these IDEA rules and regulations, and yet this statement is really not for administrative convenience. It's really not about the programs that we do have and can offer. It really should be about what the individual, child needs. And so are we really taking this, what we call the justification statement, are we really taking it seriously when we sit at an IEP meeting and we fill this out for a child with a disability who's 3 through 5? Are we really thinking long and hard about why we're not serving this child in an environment with other children without disabilities or within their least restrictive environment? And the Department of Education at the federal level gives us more guidance that the regular class includes a preschool setting with typically developing peers. So what's a district's responsibility in all of this? A district needs to provide a free, appropriate public education to children with disabilities, including children ages 3 through 5, in the least restrictive environment. What does that mean for preschool children? We're going to talk about that this morning. We need to make available the opportunity for placements in regular early childhood programs for preschool children, if necessary, to meet a preschool child's needs with disabilities. And what exactly does that phrase mean? It means if the IEP of an individual child requires a regular early childhood placement, RECP, we like our acronyms. If an individual child's IEP requires an inclusive placement, we need to provide one. That can be a hard thing to do. If the district does not have a preschool program, they must explore other options in the community, other options within the school, other options of early childhood programs. In the chat, what kind of preschool programs exist in your community? Can you list some of the programs either in your school buildings or in your community that exist for 3 through 5-year-olds? And Andrea, I'll let you share those with us if you don't mind.
Okay, we see public universal preschool, integrated preschool, universal preschool, more integrated pre-K, school readiness, which is our state-funded preschool, Head Start, community-based and school readiness in some schools, private preschools.
That's great. So it sounds like you're aware of your community options and hopefully using them. That's terrific. So are there any comments about this really quick review or any questions about what's expected for preschoolers in particular in terms of FAPE? What does a free, appropriate public education mean for children 3 through 5 when, as school districts, we're not obligated to provide those for children without disabilities, except for in your universal pre-K programs? Any questions coming in, Andrea?
Nothing yet, Debbie.
Okay. And what about the Department of Ed? And here we're talking at the federal level. What about expectations for implementing FAPE in the LRE? Is that clear as well? It's our responsibility. It's our obligation to be considering LRE on an individual basis for each preschool child. Is that clear as well? And then finally, what about the continuum of placement options? Meaningfully, beginning with the discussion of the least restrictive option with the supplementary aids and services discussed first. Is that something that you think is happening at every early childhood IEP meeting? All right, let's keep.
Okay, we see some no's, some yeses.
We're going to talk about making that more possible and making it a little bit easier to do. To ensure that you do have placement options available, it takes a lot of planning on the front end. But beyond that planning and beyond having seats available, it also takes a little bit of a mind shift sometimes in our IEP meetings, that we're really stopping and thinking about where children are and what they need specifically before we decide where we're going to provide services to them. Let's talk about inclusion facts and our guiding principles for making these kinds of decisions. So we know that children who start in preschool segregated settings are much more likely to remain in segregated settings. So it's so critically important that we get these young children started off on the right foot. Having children in inclusive programs is so important for their social well-being, for their ability to make and have friends, and for things that they're going to do later on in life. And so if we can't start them in preschool in inclusive settings, my goodness, where can they be included, right? In preschool, we know that children 3 through 5 without disabilities have a wide array of abilities. A typical child, 2 typical children are not going to look the same, even if they're the same age. 3 typical children aren't going to look the same, even if they're the same age. And we know that this disparity among young children is to be expected. It's normal and it's widespread. And so young children develop at their own pace and learn at their own pace. And we have a range of what children should know and when they should know it. And that's our barometer for how well children are doing. But children at this young age learn and develop through play. And if children can't be included in play together, I ask again, where can they be included? So if you look at this picture of children in a preschool classroom, you'll see some children doing an activity that you might see in any preschool classroom. One of the children in this picture is deafblind. The child has charge syndrome and is absolutely deaf and blind. Can you easily pick the child out? You really have to look. It's the little fella in the blue shirt, second from the left. He was included in preschool some 20 years ago, and it wasn't an easy thing. It was very difficult for his family to have him come to preschool. It was very difficult for his teachers to know how to accept him into the classroom and know how to provide for him and how to ensure that he was learning. He did have a lot of supports to be in the regular program. But being included for this young man meant that he had a group of friends that were trained. They were volunteer friends, trained to know how to communicate with him and his intervener. He played in the band. He was in the marching band. They learned when he was in high school that he had some residual hearing, and they learned that from his activity in the band. He also went to prom. But I can promise you this, had he not been included in preschool and throughout many of his years in school, he would not have had these friends or these experiences. And so the work that we do in including young children begins in preschool and is critically, critically important. So I hope you remember my friend when you're sitting at IEP meetings and thinking it's not possible. With a lot of work, it really is possible for every child. So what do we know about inclusion? What do we know, and what should we be doing from the research? Let's talk a little bit about that. There's been no study that's assessed social outcomes for children in inclusive versus developmentally segregated settings that has found segregated settings to be superior. You can find this document. I apologize that this document is not in your handout, but you can find it on the same page on the ECTA website where many of those other documents are listed. This is Dr. Phil Strain putting together for you a lot of the research that's been done on what we know about inclusion. We know how important social skills are for young children. Take a minute and think about somebody that you just really don't care for. Think about somebody that you really don't like. And then I want you to think about why you don't like them. What are the skills about them? What is it about them that you don't like? I'm going to give you a minute to do that. Now, you don't have to do this, but if you want to put in the chat any of those characteristics about somebody you really don't like, feel free. But did anybody come up with an academic level or the ability of someone to do something? Or was it more the social skills of the person you don't like that was interfering with their ability to get along with this person? What we know is that when adults are not successful in their jobs, more likely than not, it's not because of their skill level, it's because of their social skills. And we know that social skills begin to be developed in the very earliest years and are critically important, not just for the acquisition of social skills themselves, but also to be able to learn, to be able to grow, to be able to get along with peers, and finally to be in the community and to be able to work. And so we know that inclusion at a young age is very, very important. Let's talk about more of the things that we know. We know that social interaction must be frequent. It must be planned and carefully promoted by teachers. Children who are typically developing have shown only positive developmental, education, and attitudinal outcomes from inclusive environments. In other words, there have been no studies to date that show that children in appropriate inclusive environments, and by that I mean children in an environment where all children are supported appropriately, where any children who were typically developing have had any adverse effect from being in an inclusive program. Now, we know that there are differences in what inclusive programs can look like, right? So you have to have the right number of children in a program, the right number of supports, and be able to meet everyone's need in the classroom. But that's our responsibility no matter who we're teaching. So if we do that, we know that these are high quality experiences for all of our young children. Children without disabilities often develop nurturing skills. They develop empathy by being with children with disabilities, even children with the most significant disabilities. They may ask a time or two, why is this child in a wheelchair? Why can't Johnny see? Or who's that helping Johnny? But they ask once or twice and then they've accepted it and they move right on. And those experiences also carry them throughout their life and into adulthood. And they're critically important. There is no evidence at all that children with particular types of severity of disabilities cannot be included. So we tend to think sometimes that children have to earn their way into preschool, or they have to earn their way into a seat in a classroom, and that's really not true. We also know from research that the children that make the most progress, and we're talking about relative progress and we're talking about social progress, but when you consider children with the most significant disabilities, when they're included, they make the biggest relative gains. And that's critically important. I wish I had more time to talk to you about the times that I've actually seen this happen, and how critical it is when children connect with one another in ways that as teachers, we just can't connect with them. You've probably seen it yourself. We know, just like adults, children generalize skills more effectively in inclusive settings. So think about if you get, I don't know, a new lawnmower perhaps, or a new kitchen gadget, and it's complex and it has instructions. Maybe you're like me and you don't like to read the instructions, but we know that if we're presented with the instructions before we order the machine or before we have to use the machine, reading the instructions means nothing. If we need to use the lawnmower or the kitchen item, we might be more interested in looking at those instructions, and it's no different for young children. Children need to use their skills within the context of everyday routines and activities for them to be meaningful, and for them to generalize them, and for them to be able to generalize them more effectively. And finally, from the research, we know inclusive programs tend to be higher quality. When people are intentionally creating inclusive programs, they're paying attention to the needs of all the children in their care. And they tend to have special educators helping regular educators better understand the needs of children that might need more support. And conversely, our special educators are often learning from our regular educators how to handle more children in a classroom and the other tricks of the trade that regular education teachers are a whiz at. Let's talk about a few more inclusion facts. These inclusion facts are research-based as well. On the ECTA website, you'll find a very comprehensive list of many of the studies on inclusion. They've been synthesized into some facts. Today on this call, we're just going to be looking at a few of them, but please get on that list and look at the facts that we know from research. There's also a study out of North Carolina that's not associated with these, that's looked at high quality preschool education for young children without disabilities. They've shown a 30% return. In other words, children who attend these high quality North Carolina preschool programs have 30% fewer referrals to special ed in kindergarten, first grade, second grade, and think about that savings over time. But let's talk a little bit about the inclusion facts that you can find on the ECTA website. There's a long list of the facts in the research base, and then there's a short, more synthesized version of the facts. I would urge you to go on and look at those and discuss those with the people that you're working with. Inclusion benefits children with and without disabilities. We know that from research. We know that inclusion is generally less expensive than having separate programs for children with disabilities. That probably requires a conversation for you to believe it and for us to really discuss how that works. But the data is there. Inclusion is generally less expensive than separate programs for children with disabilities. Children with disabilities do not need to be ready for preschool. Preschool programs need to be ready for children. A couple more inclusion facts. Children with disabilities can be satisfactorily educated in the regular early childhood program, regardless of their disability. But what it takes is specialized instruction, intentional and embedded opportunities for learning, and when there's time for effective collaboration and learning between all parties, and that includes families as well. All right, this is something that, this is kind of my walk of shame. I worked in a State Department 20 years ago for 10 years, and inclusion was something that we were all paying a lot of attention to. My background had been teaching children with very significant disabilities, and I found myself at these meetings going, yes, I agree, inclusion for all those high-functioning children, but not my children. We had made the case for why these children could be educated in the schools, but they needed our specialized support. And I really struggled so much and felt that I couldn't tell anybody that I didn't really believe that it was true for all children. And I thought people that talked about inclusion for all children, and particularly all young children, hadn't seen the children I'd worked with, or hadn't worked with the children that I'd worked with, or perhaps didn't have the skills that I had. And so I went to an inclusion conference in North Carolina, and Dr. Don Bailey presented slides that looked something like this. And he talked about the juxtaposition of being included or segregated, right? You can be included in a program or a community, or you can be segregated and not a part of it, and they're on opposite parts of that spectrum. You can be just there in the classroom, or you can be in the classroom with specialized instruction and the supports that you need. And then he showed, uh-oh, my computer's frozen. There we go. And then he showed that for our children to be successful, they have to be included with specialized instructions and supports that are necessary for them and determined individually. And what I realized was I wasn't against inclusion at all. I was against children just being in inclusive programs, but not having their needs met there. And it's been 20 years since we first started really focusing on the importance of inclusion, and particularly inclusion for young children. And we know we can do it. We know that it's not rocket science. We know that children are much more alike than they're different.
Debbie, we have a question in the question and answer section. The question is, how do we provide FAPE in the community when each program has its own guidelines? How does LEA staff monitor a child's progress, and who provides the supports? Does the LEA enroll and pay for the child?
Oh boy, does the LEA enroll and pay for the child is a conversation. We really can't answer that as a yes or no. It's complicated. And the Dear Colleague letter that Andrea's forwarded on to you does not answer the question adequately either. But we could have another conversation about that. We really would need to have an in-depth discussion before we can answer that part of the question. The other part of the question is a little bit more simple. So think about special education for your school-age children, and think about the notion of excess cost, and think about the notion of special education layered on top of regular education, right? So for regular education for children who are school age, special education is added on top. It's in excess of their regular education. So for preschoolers, think about it that way too. Preschool special ed should be layered on top of those developmental experiences that children are getting wherever they're getting them when possible. So it's not a simple answer, it's a complicated answer. Generally speaking, if you're going to provide supports in a program that a child is already attending, it makes it a little easier, right? The family's chosen that environment, perhaps. You're bringing in special ed, that's what you're responsible for. It gets a little more complicated when you're actually the one seeking out the program to put the child in the community. And so I think the simplest answer is it's really critically important to find out where children are, find out how they're doing in that program, and find out if you can provide that support that's in excess of how they're developing and learning typically, right? So that's a pretty simple answer to a very complicated question. And that really is exactly what we need to be thinking about and talking about. So if you have more particular questions about that, I'm sure that wasn't a very comprehensive answer. Please continue to put those questions in the chat.
And we've also been asked if you could provide the citation for the current study, The Positive Effects of Pre-K Inclusion.
Absolutely. And if we do talk more about some of the other topics we have planned, we'll absolutely get more of this information out to you. And Andrew, will you make a note of that for me? That we'll include that afterwards. Thank you so much. All right, let's keep going here. Let's talk a little bit about guiding principles. We've talked about what's required. We've talked about the facts that we know about. So when you think about these young children in LRE and how important, I know that you agree with me, inclusion is, what are the guiding principles that you hold near and dear? What's a guiding principle? And just a phrase, we don't have time for a lot of sentences, but what's a phrase that you believe in working with young children with disabilities? What's a principle that you try to keep in mind as you sit at these IEP meetings and see families that are so concerned for their young children and are coming to you for support and assistance? And Andrea, I'll let you read those as they come in.
Okay. That all children need to have access to the general curriculum, that we should assume competence.
Assume confidence. That assume competence is a wonderful principle. That's a great one. Access to the general curricula. That's not just a principle, that's a requirement too. Great comment. Thank you.
Okay, and a question came through in the question and answer box. So the district would need to provide a special ed teacher and related service staff to all private preschools in the district where special ed students attend.
Could be, yep, some kind of supports. But now think about the continuum, think about supports. I told Andrea I probably wasn't going to say this, but I guess I'm going to. If a child is in a program, a preschool child's in a program, their needs are being met there to some extent. What we know about preschool programs is they have latitude to dismiss children pretty much at will, right? Because preschool is not a mandatory placement. So oftentimes when children are in a preschool program, they're doing pretty well. They're doing okay. They're in the program because what we know about these preschool programs is if children don't do okay there, they're invited not to be there. Oftentimes it's very subtle. It's this program doesn't meet your child's needs, or your child's not ready for this program, or there may be a better program for your child, or Johnny's having a bad day, so please come and pick him up. And when a family is disrupted at work enough times, they don't go back there. So we know that all these subtleties happen, but if children are attending early childhood programs somewhere, they're doing pretty well there. So if they're doing pretty well in a preschool program, working with the staff, providing consultation, providing the supports a child might need, it doesn't mean it's an all day, every day special education service that you're providing. That's the part of the continuum that we talk about, right? So there's all different levels of support. By making available in your communities a network of all of these various early childhood programs, you can meet the needs of all the children. So I'm not saying that every child, every family picks the program they want to be in and you follow them and provide whatever services are necessary. We use the programs we have. We create inclusive environments by partnering with our community partners whenever we can. And whenever a child, this is probably the most important thing I'm going to say today, whenever a child is in a program, we always start by considering what supplementary aids and services does this child need in this program to make the progress that we're expecting, and can we deliver it? And that needs to be a meaningful conversation, because I think, as we all agree, these kids are so much more like the kids in the classrooms with them than they are different. All right, we're going to have to go kind of quickly here. So guiding principles. We know that children with disabilities benefit from interactions with typically developing children, opportunities for engagement and learning, instruction embedded into everyday activities and routines, and experiencing fewer transitions. We know all of these things are critical. Think about those of you that have children or know young children. Think about any child on their worst day. They're a handful. It's really, really difficult for young children to be in an environment where they have a lot of transition or changes, or they're little tiny people trying to learn their way, and yet so many things are thrust upon them. And so the more that we can meet their needs by helping them experience fewer transitions and having more meaningful schedules that don't change, I think the better off we'll all be. So now we're going to look at some of these guiding principles and see if we agree with these statements. So please think of 0 as, nope, don't agree with that one. And 3 is, yeah, I strongly agree with that one. So as we go through these, do we agree principles? If you'd put a number in the chat, 0 to 3. Every child will grow and learn with access to developmentally appropriate materials, activities, and experiences. So for number 1, 0 to 3. 0, you don't agree. 3, you do.
The 3s are rolling in.
All right, great. Let's try number 2. And please push back if you don't agree. Let's talk about it. Number 2, learning occurs best when presented within everyday activities and routines. Let's rate that one.
Again, we're coming in with all 3s.
Okay, that's great. Children do better with access to children of similar ages.
Oh, I see a few twos, a
Okay.
0, bunch of twos.
Okay. If you put a 0 or a 2, or if you've got a comment, please put that in the chat box. This is a good one to talk about. So how do children develop and learn? They develop and learn by the experiences that they have. Does a 2-year-old, let's say 3-year-old, does a 3-year-old have to be next to a 3-year-old to learn? Nope. But will a child learn a lot more if they see another child doing something? Yep. We know that from the research. So we know that children learn, develop generally in families, right? Where they're exposed to children of different ages, unless they're an only child. We know that when children have exposure to other children, they have more enriched activities. We know children learn developmentally through parallel play and then cooperative play. These are stages in learning. And being able to have cooperative play requires children of somewhat similar ages for our children to have those experiences. So I would say that we can consider preschool children, 3, 4, and 5-year-olds, to be children of similar ages. So let's.
And there are some comments, Debbie, about the benefits of mixed age grouping.
Perfect. Absolutely. I couldn't agree with you more. Do we agree that 3, 4, and 5 preschool ages are similar ages, and that children do better with access to children of similar ages or slightly older children?
Yes, there's lots of agreement about that.
Okay, good. Good. Shoo, I'm glad we found one to talk about. All children can be included with the appropriate supports. And here I really do mean all children. Do we agree with that?
3s, I have 1, 3s.
1, okay.
Yep. A
All
2.
right. If you've put a 1 or 2 in there and you don't mind sharing maybe the characteristics of a type child that might not be able to be included, that might help the discussion. I can tell you that I was in the classroom for many, many years. And then at my time at the State Department, I went to many, many IEP meetings, mainly for preschool children. In all the time that I've done that, I can honestly tell you, I can count on one hand the number of children that would need a level of support that would make participation at some level with peers difficult. And I'm not saying that inclusion means all day, every day, but we're going to get to Andrea's rule here in just a minute. I think
there are some comments here about inclusion as long as safety precautions can be maintained, that that sufficient supports can be challenging due to budgetary restrictions and lack of peer models. And also a note that appropriate supports are key.
Appropriate supports are key. I couldn't agree with you more. I think that one of the reasons that it's so difficult to do this is that we do have to build these supports up. We do have to build these community resources up. We don't have the capacity to do this by ourselves. So I absolutely agree with your comments. I also think it's fair to say that children with more significant disabilities or behavioral issues certainly require a level of support to keep them safe. And these children may be children with or without disabilities, because as we all know, behavior alone is not a disability, right? So absolutely agree with everything you've said, but we can meet these challenges.
And there is a note here. We have some children who have needed to be outplaced due to the severity of their medical needs, nonverbal, feeding tubes, etc.
And I would share with you that we've got some wonderful videos from Larry Edelman out of University of Colorado about how to include some of these children in some activities some of the time. So they are a unique set of children, but they too sometimes can be included if that's possible due to their medical conditions. So absolutely agree with everything y'all are saying. So it takes a special educator to support the learning of children with disabilities.
An additional comment about students with significant medical needs could be difficult, as well as students with significant behaviors.
It can be difficult, but it can be done. Absolutely, it's difficult. This is not easy work. So how about it takes a special educator to support the learning of children with disabilities?
I see 1, 2, 0,
That's a
2,
trick question. Good.
1.
It takes collaboration of both teachers with special education experience, families, and regular educators to support the learning of children with disabilities and peers. And this one I added, this one may not be in that copy of the PowerPoint that you may have. Families should not have to choose between childcare and IDEA services, and far too often we're making that happen. I'm sure that I know what you would say about this one. All right, we're going to move on. We're going to talk very quickly about the IEP process. This is not anything new. The rules for IEPs are the same for all children. Follow the IEP process sequentially. Involve families meaningfully and with families' permission, the child's teacher. Maybe the child's preschool teacher, if they have one, can't come to the meeting, but could they let you know how the child's doing? Can they send in some of their artwork, or could they write you a note? Many preschool teachers have those all about me little books that they create about the children in their classrooms. So some kind of a meaningful way to involve families and the child's teacher. Respect and reflect the child's individual strengths and needs along with the family's culture, priorities, and preferences. We know that there are many different ways and different culture norms for how to raise young children. Some young children should be seen and not heard. My mother-in-law certainly felt that way. And in other places, there are just different expectations of when children should do things, like when they should feed themselves, when they should be independent, when they should do any number of different things. And we need to be aware of that and be mindful of it. We need to ensure that children participating in Part C early intervention programs have a smooth and effective transition. And we know that we need to look at young children in all aspects of a suspected disability in real life situations, in real life contexts. And sometimes we've gotten away from that. I worked in a physician's office for a number of years, and I was so proud that I could have a child that I didn't know, disengaged from his family, come sit with me, a 3 and 4-year-old, come sit with me for 30 minutes and do a developmental assessment. Not a great way to look at a child's skills. And I can tell you some of the things I learned through that process if we had more time. We know that we need to document present levels of functional development. Here we're talking about functional development. How does the children function in their everyday activities and routines across all domains? How's the child, not just how do they have the skill that they can display in an assessment situation, but how do they function in the real world? And then this one's critically important. We need to develop goals that are developmentally appropriate and functional that could be implemented and met across settings. So often when we write goals for young children, we set ourselves up that now they need to be done with a clinician, or now they need to be done with a specialist, or now they need to be done in the special ed room because that's the way we've written them. We know we need to discuss placement as a team, including the parents. We know that we need to discuss supplementary aids and services that are needed in the regular program. That should be the most meaningful conversation that you have for every young child, and it has to happen after you write the goals and before you discuss placement. And it's critically important to consider a regular early childhood placement that a child may already be attending. We're required to consider the benefits and any possible negative effects of the placements that we discuss. We'd also say that it's really easy to front load IEPs at the beginning of the school year, generally because we have rolling enrollment for those 3 and 4-year-olds that we identify during the year. We should have more preschool staff than we really need, knowing that we're going to have 20, 25, 30% increase in the preschool children that we're going to serve. Those folks can provide more supports on the front end to the kids we're starting with, knowing then that we're going to pull some of that support away as the children no longer need it. So what I mean by that is put somebody in that regular classroom a couple times a week to start with, but know that you're going to re-meet and pull that level of support back once you get some of those things in place, like some of the visual schedules, some of the supports that a child needs that really benefit all children. All right, let's keep going. Another consideration, special transportation as a related service if needed, documenting the extent the child might not participate with typically developing children. And this is really important for administrators. We really should be documenting placement discussions in prior written notice. And I hear so many times from 619 coordinators and administrators that, you know, these are IEP team decisions. We're not going to second guess what an IEP team does. And I understand that completely. But we do want to ensure that an IEP team has had the meaningful conversations that we know it's required to have. And we know from the data nationally that we are not serving a lot of young children in inclusive environments. We're just not.
Debbie, there is a question in the Q&A about children who benefit from small learning environments. Since 50% or more of the students need to be non-IEP students for a classroom to count as an inclusive setting, most likely you're looking at a classroom with 10 to 16 students, which can be very overwhelming for a child, especially with sensory needs. Sometimes a child can only make good progress in a small environment with only 3 to 5 students.
I would say this, that's one of those situations where you want to get that child into that bigger classroom as soon as possible and for as long as possible. If it's an hour a day to start with, it's an hour a day. If it becomes 2 hours a day later, or 3 or 4. And yes, some children, many children need small group environment to learn. However, that small group environment can be a learning group within a larger classroom. The beauty of early childhood programs is that they're set up to be a lot of small opportunities for learning throughout the day in a number of different developmentally appropriate situations. So again, we're not talking about necessarily children being in a regular placement all day, every day, but our goal, if we're writing a goal for a child and we have them in a small environment, can we move that small environment to within a larger environment? I've seen children respond so well to their visual schedules and do things that we never imagined they could do, but they do them because the other children are doing them. Doesn't happen for every child, doesn't happen every time, but one of your participants wrote down that we need to assume competence. We do need to assume competence. We need to start from what can this child do in this large group? Can this child be here an hour? Can this child come in and participate in small group? What can the child do in the larger group? That should be where we start.
And also, somebody has asked if you can share the staffing formula to be shared with superintendents and boards of ed. It's a constant battle when budgets are developed based on October numbers.
Absolutely. So I hope you're taking data in your district of how many children you end up with in the spring and how many children you start with in the fall. From my experience across states, it tends to be between 20 and 30%. I don't know if that would hold true in your district, but you can count that up, figure up the percent change and plan for that eventuality. It's always surprising that we start with all of our classes full, and then we're surprised when we have no place to put these young children that we know are going to be coming. So quickly, LRE decisions are not made based on a disability category. That is so critically important. And let me back up. I'm not sure if I addressed the first one. LRE decisions are based on the strengths, needs, and goal of each child. So going back to that child that needs that small group instruction, could that small group occur within a learning environment within a preschool classroom? Another thing to remember, not every child needs to learn everything exactly the same way. Maybe it's important for that child to have some hour or 2 hours of individualized small group instruction, but will they benefit meaningfully if they participate in the large group, even if they're not doing everything like every other child? Real quick example, because this is an important point. I had a child that was included in kindergarten, real large school, 9 grades, 9 classrooms in every grade. Teachers don't come to the resource room to find out, to share information in the middle of the day. But I had a teacher that sent for me. She was mortified. And when I got down to the classroom, she showed me this paper plate person that my child had put together, or the child from my classroom had put together. Everybody else had this really cute little figure with eyes and ears and arms and legs. And my child's figure had lots of body parts. They weren't in the same place as everybody else's body parts. I was thrilled. I thought she was showing me what a great job he had done. She thought he shouldn't have been there because he couldn't put his ears and his legs in the right place. So again, it's really relative, but that child sat with his peers and did an activity meaningfully at his level, and that's really important. We need to consider the benefits and any possible negative or harmful effects. We've talked about that, and I realize I have repeated myself a lot, We must begin the discussion with the supplementary aids and special education and related services the child would need to be successful before we say child needs a smaller program. And yet we need to know, we need to do better. This is Andrea's comment, and it's a really good one. 80% of children in regular early childhood programs, 80% of the time. That's a really nice goal to try and master, right? 80% of the children, 80% of the time. I think we can do it. Look at our children as they get older. That's probably where you are with your school-age children. So why aren't we there with preschool? How does your district provide inclusion? And we've already talked a little bit about this. So for the sake of time, and I knew we wouldn't get through everything, we're going to keep going through this with the exception of including speech language services. Let's talk about inclusion in speech language services. We know that our speech language pathologists have high caseloads. They see more children than a classroom teacher would. We know that. It's hard sometimes to get these speech language pathologists in the classroom. I know they believe in, my sister's a speech language pathologist in Connecticut. I know how much she advocates for her quiet time with her children. On the other hand, going into the classroom and helping children generalize their speech language skills and helping the classroom teacher who's with them much more of the time know what skills to be working on provides a lot of bang for the buck and is critically important. And I would go so far as to say, if you get a speech language therapist in the classroom, part of the time that they're providing therapy, part of those special ed services, you won't get them back. They won't go back to just doing isolated services. It's critically important and the benefit is really and truly there. So we know that we need to be doing this. We all agree we need to be doing this. And we know it's hard for children with the more significant disabilities. And yet we're not doing this. And we're not doing it not just for children with more significant disabilities, but for children with that could be easily included. They could be easily included if we had the placements for them. So we know we have to grow the placements. We know we have to grow our thought process of how we serve them. We know that there are considerations in the process from referral to transition, crafting the IEP, and determining placement. And as we talked about all these things over the years and putting together this tool that's not yet released, we worked with OSEP. We had a lot of presentations at conferences, and we had things done sequentially. Here are the facts. Here's the research. Here's what we believe. Here's the IEP rules. And everybody said, yeah, we all agree with that. And yet when we said, but why aren't children being included? We had lots of reasons why it wasn't happening. And so what we came to realize is we're not matching up what we believe with each step of the IEP process. So what we've done in this tool that will be out soon is we've taken the key areas of an IEP meeting, the process, from referral to placement decision, and we've put the guiding principles right there next to it. And we've put a scenario right there next to it so that you can talk through it. And we've put down the corresponding regulation, the principle, and what it looks like. And we hope that there'll be conversation starters because, again, I know I sound like I'm preaching. I know I'm a converted inclusionist because I didn't start from a position of thinking that all children could be included. I know it's hard work, but I also know we can do it. And so I think that if we can get these conversations started along each step of the process and figure out where it's breaking down and why it's breaking down, we'll have better luck. Within this document that's not yet released, and we're not going to have time to do this together, but here's the consideration number 7, and I think there are 11 considerations, something like that in the document. OSEP is doing another read through of the document. It was published for a split second, then there was a change in administration and we're having it reviewed again. You know that we've talked about the order in which something has to happen, okay? Let's move on. This is an example of what one of the scenarios would look like. I would have liked for you to have a chance to read it and share better strategies in the chat, but we just don't have time, and I apologize for that. But know that this resource is coming, and we hope that it will allow you to continue these conversations with Andrea, maybe in a community of practice, with your colleagues. What we know is that, let me back up and say, this IEP meeting started with everybody sitting down and the district talking about their preschool program, their special ed preschool program, the one and only placement that they had to offer this family. And we know that we just can't do that. We have to start by talking about where children are. We've created some guiding questions. The guiding questions aren't meant for every child. It's not a checklist, but they're things for IEP teams to really consider meaningfully. And the key word is meaningfully. How's the child doing in the early program they're attending? Does the family want the child to remain in the program? Does the school system have itinerant teachers? If you don't have an itinerant teacher or a plan to be able to serve children in other settings, it's not going to happen. It takes planning. Does your district serve children in their community settings whenever possible? Here's some more guiding questions for all children. What supplementary aids and services would the child need to be successful? Can you remember the last time this was a conversation that started each IEP meeting? Can the IEP be implemented in the regular early childhood program with aids and supports? And again, we write IEPs for a year, but we can still write them in stages, right? Like, we're going to front load this IEP. We're going to put a teacher with you or an assistant with you for the first 2 weeks, and we're going to get lots of supports in place for your child. And then we're going to look again at what this needs to look like. But starting from a position of, let's try the classroom and then back out of it if a child can't be successful there. Will the proposed placement allow the family to access childcare? That's huge, and far too often we're forcing families to make that choice. We've talked about these other questions throughout the presentation. Let's just look through them very quickly, because in the 1 minute we have, we've got a really quick poll. So Greg, can you pull up the poll to see if there are any further conversations, if folks want to continue this conversation?
I can do that. I'll be launching the poll right now.
Thank you. Thank you. And one of our cardinal rules is to end on time. So while you're looking at the poll and the list of topics, could you also think of one thing that you can do to make it more likely that good placement decisions can be made in your district? You're welcome to put that in the chat if you want to share it, but can you commit to one personal thing that you can do to help facilitate good placement decisions for young children? And then Greg, when you have the chance, when it's the right time, you can share the poll with us. I apologized, it was rushed. I knew we'd have more information than we had time to get to. I hope it was meaningful for you, and best of luck to you. And I hope you enjoy the rest of your day. Let's see what our shows us.
And while we're waiting for the poll results to be displayed, Debbie, I want to thank you very much for taking the time to be with us. And we certainly would love to have you back to have some deeper discussions about some of these topics.
Thanks, Andrea. It's been my pleasure to be here. Let's see what we've got in the poll, Greg.
Okay, we're at 64%.
That's okay. That's good. I'm sure people have had to leave.
Okie doke. And here are the results.
Oh, great. So people are interested perhaps in carrying forward the conversation. Andrea and Greg, thank you so much for the support, and we'll be talking more. And Andrea, if you have more questions and would like to talk about those, we can do that as well.
Great. Thank you all. Everybody have a great day.
Have a great rest of your day. Bye-bye. I'm sorry. I knew that we'd have probably too much material, but